Well, I'm really happy to be back. I was here a few, I guess it's almost been a year ago. I can't believe it's been that long. No? Okay, good. It's good. At least that's memorable, right? It's always very flattering to get invited back, and I really appreciate the invite to come back and to kind of complete the presentation on Medicare. I'm Calvin Bagley with the Medicare Store. I'm one of the managing partners with the Medicare Store. We are owned by a company called Sun City Financial. And what we are is we are an agency of insurance agents that specialize in Medicare, Medicare insurance, Medicare Supplements, Medicare Advantage plans. And I'm I'm one of those nerds that stays up late at night and reads about the Medicare rules and how everything works. And so I've also learned a lot of things about how Medicare all works together in addition to the insurance part. So I wouldn't go so far as to call myself an expert. I'm certainly not endorsed by Medicare or anything to that degree. I'm just one of those guys that figures out all the little rules and how everything fits together for the benefit of the people that we try to serve at the Medicare Store. The Medicare Store, we have a total of approximately a dozen insurance agents, and we have multiple locations, and we come out to people's homes, and we do presentations like this as well. And I love it when I get a chance to do a presentation like this because I get to wear my very comfortable polo shirt. And today I even found matching tennis shoes, so I'm very comfortable up here and I'm ready to take any questions that you have. So as we go through the presentation, I don't think of this as really a lecture. I think this is an opportunity for us to teach you something and for you to ask any questions that you have and for me to maybe clear up any concerns that you have. So as we go through this, please feel free to raise your hand and ask a question or interrupt me and say, wait a minute, I didn't get that, I want to understand more, because I want you to kind of guide our discussion, and that way it also helps you to stay engaged and to know what's, and to learn something from today. Because Medicare is one of those topics that it can get a little dry, and it's nice for us to kind of interrupt it with some conversation and the questions that you have, okay? So last time I was here, we went over some of the basics of Medicare. So to kind of just start us off, I want to go over some of those things and get us back to where we were. And then today, I'm going to focus on the insurance side of Medicare Supplements, Medicare Advantage plans, and prescription drug plans, and how they work together with Medicare, because that's the part that we didn't really get to last time. I have to tell you in kind of a little disclaimer that as we do this, this is an educational event. And so at an educational event, I am prohibited as an insurance agent from making any sales pitches. So on one side, that helps you to feel at ease that I'm not going to try to sell you anything. On the other side, it can kind of hinder a few things, because if you ask me specifics about, well, how much does that cost? Well, I can't give you benefits today. I can't tell you how much this plan is versus that plan. We're just going to talk about the basics of the plans. And if you have questions that go beyond that, we'd be happy to answer those on a one-off basis, okay? So that's kind of all you need to know before we get started. So I'm going to use, well, I say that. There's one more thing you need to know. I am not a representative of United Healthcare, even though I do represent United Healthcare. I am a contracted agent with United Healthcare, but I'm an independent agent, and so I work with all the different insurance companies. So today we're going to use United Healthcare materials because we really like the Medicare Made Clear program that they put together and allow us to present, but it's not, we're not representatives from United Healthcare. And I said that was the last one, but guess what? I got one more. I also have a companion here with me today. Andrea Scott is one of our agents with the Medicare Store. So after the presentation is over, she can also answer questions if you have specific questions. All right? Okay, I promise that's it. Let's get started. So with Medicare Made Clear, we're going to talk high level about who is eligible for Medicare. Then we're going to really dive into what are my coverage options, when can I enroll, et cetera, et cetera. So first, to be eligible for Medicare, most of you are aware you have to be a legal resident for at least 5 consecutive years and be 65 years of age or older, or qualify on the basis of a disability. One of the disabilities that gives you access to Medicare immediately at any age is end-stage renal disease and also Lou Gehrig's disease, or ALS. So once you have Medicare, boy, that was quick, right? What are your coverage options? With Medicare, there's Part A, B, C, and D, and there's something called a Medicare Supplement. And the Medicare Supplements also have A, B, C, and D, just to add some, a little bit of, I won't say confusion. It's not meant to be confusing. But I shared with you last time I was here that I was reading, and they said that as you age, in order to keep your mind fresh, you're supposed to do puzzles. I think they had that in mind when they designed Medicare. So, right? So you put these puzzle pieces together little by little, learn a little bit about Medicare every day, and you'll stay young. All right? Yes, we have a question.
Well, I just got onto Medicare recently, and I already had a problem with the enrollment situation. My birthday was May 31st of 2016. I turned 65. But I wanted to wait till the last minute to sign up because I got to pay $134 a month.
Uh-huh.
So the Bible, Medicare and U book, I didn't even have one to begin with.
At the Medicare store, we pray on that, by the
Well,
way.
anyway, I use this for everything.
Yes.
They didn't even send me one. My neighbor happened to get two, one for her, one for her sister, so I got the Bible. So I thought, well, so I called him up. I got 3 different answers as to when my actual deadline would be to sign up and not pay a penalty on D like dog.
And you missed the deadline.
No,
okay.
Unfortunately, well, they haven't said anything. In other words, they said I had till August 31st, and the sign-up date was August 30th because they don't let you sign up on the 31st, so that's when I signed up. So unbeknownst to me, nobody ever told me, and the book didn't say anything about it, that I was already on A since, my birthday month. Mm-hmm. But I didn't know this.
Yeah.
So
well, let's do this. This is really a story. And we need to talk to you one-on-one about this.
But I'm just saying, I finally got on it and I'm okay.
And you're okay.
Yeah.
Frustration, though. Enrollment can be
Right.
frustrating if you don't know all these little things. So if there are other specifics, then we'd be happy to take those one off. But you made it there.
It wasn't even enrolled.
Yeah. So
she was paying the $134 for B because she already had A.
So let me explain these and it'll make sense. A doesn't have a premium if you worked at least 10 years or 40 quarters. So you were enrolled in A, you said, I'm going to wait on Part B. You didn't know you were enrolled in A, but you were enrolled in A, and you wouldn't have to pay anything for it because A doesn't have a cost. Now it's based on whether you working 40 quarters or a spouse, if you're eligible through that, a spouse working 40 quarters. So you already had A. Now Part B does have, for those who are enrolling now, it's $136 a month for Part B, and that's what you were trying to delay until the last possible time to enroll. But you then brought in Part D. Once you have A or B, either one, then you are supposed to sign up for a Part D plan. You don't have to have A and B to get a prescription drug plan. You can have A or B or both. So when you were signed up for Part A, you were then eligible to have a prescription drug plan, which is Part D. These letters start to get confusing. You see what I mean about the puzzle? I see people writing down and say, oh my goodness. Also in the handout that I have, there is some really nice graphs on that. So I've seen some people already. What page are you on there?
They're not numbered.
They're not numbered. Okay, she's on the not numbered page. But with A and B,
7, 8. That one's 7.
so A and B these are the parts that you get from the government. These come from Medicare, A and B. And we're going to talk about A and B in more detail. But this is what we call traditional Medicare or original Medicare. This is what Medicare was when it started. It was Part A and Part B. The other parts have come later. C is called a Medicare Advantage plan. Usually it's either an HMO or a PPO from an insurance company. And it takes all the other parts of Medicare and wrap them into one plan. And we'll talk about that in a lot of detail today. D is the prescription drug plan. And for all of your parents, when they had Medicare, they didn't have prescription drug coverage. Part D, these two parts only started in 2006. So these are newer parts to Medicare. A lot of people complain to me about the drug coverage for good reason. There are some real gaps in the drug coverage that we're going to talk about today. But it's a lot better than what was available for your parents. They didn't have drug coverage at all. So it's getting better. And then the last thing here, the Medicare Supplement. Medicare supplements are secondary policies that cover some of the missing, the open holes, the deductibles, et cetera, that you find in Medicare. So we'll talk about what a Medicare supplement is today as well. Question?
How does then the Advantage plan differ from a medication supplement? Because they're the Medicare supplement, aren't they both insurance company things?
Yes. You know, it would be good to address this right in the beginning. The question is, what's the difference between the Advantage plan and the supplement? In this handout that you have on your chair, the Getting Started with Medicare, I'd like you to open to page 5. Because this gives a nice illustration. So, in order to be eligible for either an Advantage plan or a Medicare supplement, you have to have Part A and Part B. So if you only have A or you only have B, you cannot have a Medicare Advantage plan or a Medicare supplement. So you have to have first, the ticket to the game is having A and B Medicare. And you get the card in the mail, the red, white, and blue card that has your Part A and Part B on it. Then you have 2 options to choose from. There's actually a third option that's not listed here. Remember, this is from United Healthcare. Third option is just keep A and B and have nothing else. So that is an option. Anyone who sits in front of an agent or calls a friend or speaks to anyone or actually learns about Medicare will realize that's not a good idea, because you won't even have drug coverage if you only have A and B. So it almost goes without saying, we don't usually have to explain to people why they need to consider one of these 2 areas. So option 1 is to have a Medicare supplement and a drug plan. Option 2 is to have a Medicare Advantage plan that's everything together. So I think of it this way. Option 1, I like to think of things in terms of food, because I like food. So if you went to a restaurant and you said, I want to buy my meal, I'm going to buy my entree, and I'm going to buy my side, and then I'll put my own meal together, be a la carte, right? That's this option. So another way to think of it is, what do you carry in your wallet? You carry your Medicare card, you carry your Medicare supplement card, you carry a prescription drug plan card. The Medicare card is from the government. The supplement card is from an insurance company, and the prescription drug plan card is from an insurance company. They may be different insurance companies. So you have each piece separate.
Could they be the same company though too?
They could also be the same company, but they'll be separate cards still. Thank you. Over here on the blue side for the Medicare Advantage plan, this is more like a combo. It's like going to a fast food restaurant and saying, give me a combo number 1. I've got my fries, I got my Coke, right? I got my hamburger. It's all together, because with this, you only carry 1 card in your wallet. You carry the card from the insurance company. So this example today is with United Healthcare, but it could be other. There are 4 companies in Las Vegas that offer this type of plan. You would carry their card in your wallet. When you go to the doctor, you give your card from the insurance company. When you go to the pharmacy, you give the same card. Now the difference between these 2 is what we're going to get into today. But at a high level, with a Medicare supplement, you have Medicare as your primary insurance. So you go to any doctor that takes Medicare, and if they take Medicare, they also accept your supplement. So what does that mean about something like networks? There is no network, really, to speak of. There's just the question, do you accept Medicare? So in essence, you've got nationwide providers. You can go to anyone that can bill Medicare, which is a lot of doctors, hospitals, clinics, etc. On this side, on the Medicare Advantage side, you now have a network from that insurance company. And you must either go to their HMO or their PPO doctors, the ones that accept the plan. If you go to a doctor that doesn't accept the plan and you say, well, I still have Medicare, right? Well, yes, you do, but it's from an insurance company. Let's say you use this card at a doctor that doesn't take this plan. What happens? You have to pay everything. Your original Medicare is not valid at providers that don't accept that insurance company's plan. So when I say it that way, it sounds like, why would anyone do that? Well, most people do that because of the cost. Because the costs associated with these 2, oftentimes the cost ends up being in favor of the member to go with this route. but there are trade-offs again. Here we're at the Cleveland Clinic today, and it's very nice of them to invite me here. These types of plans are not generally accepted at the Cleveland Clinic because this is a clinic that has a certain demand, right? And people want to be able to come to the Cleveland Clinic, and so they accept Medicare with a Medicare supplement. That's true of places like the Mayo Clinic and the Huntsman and Cancer Center, MD Anderson. Those places, they accept Medicare with a supplement. But it's not to say that you're not going to receive good care if you're on a plan that's only from an insurance company. You're going to receive the care from the providers that are within the network of that insurance company. Does that answer high level your question?
Yes, very much, and it clears a lot up, and that's really important for people to know.
It is, and we'll give you one moment. There's so many people that don't understand the difference between these two options. And so we meet with them all the time and we ask them, what do you have for your Medicare? They say, I have a Medicare supplement. What's your Medicare supplement? And they name an HMO or PPO. And so most people think that whatever insurance they have is a supplement. But today I'm going to teach you the difference between these plans and explain to you why you might choose one versus the other without going into the detail of the actual benefits or the costs, that sort of thing. Okay? You had a question?
I was just going to say that I joined a Medicare Advantage plan, and I haven't gone yet because I finally got the third time's a charm on getting a card with a doctor's name on it that I could go to.
Yeah.
The agent signed me up with somebody that was full, wasn't accepting new patients. So that took more than a month. The second one they got me to was not in the location that the provider network said it was. The third time, called up, got somebody I thought. A little voice in my head said, you better check on this after 2 weeks has passed, because you haven't received your card yet. So I called up, they hadn't gotten me on the doctor yet, so I just recently got the card.
So you had some challenges
So
there.
now I haven't used any of the providers, so I don't know what I'm going to run to when I get into that.
We'll talk a little bit about networks when we go into here. So, yes, one more question.
Why did they put the Social Security number on the Medicare card? People carry their wallet, identity theft.
That's a question about why is the Social Security number on the Medicare card? I was talking to you before and I said you should write your congressman. And you said, I've run out of pens. Those are just one of those things that just is what it is. But with your Medicare card, there are a few things you're allowed to do with it. One is you're allowed to laminate it, right? If you have a Medicare Advantage plan, you can put it away somewhere safe and lock it up at home and never carry it with you. But if you have Medicare and a supplement, then you need to carry it everywhere you go, and it has your Social Security number on it in most cases. Some cases it has your spouse's.
All cases.
Well, sometimes it has your spouse's Social Security number if you qualify under your spouse.
Oh, okay.
But it has someone's Social Security number on it, right? So you have to safeguard it. Unfortunately, that's just one of those, it was made in the 60s and it is what it
There's
is.
a process
During the process of
Yes,
removing it.
they are.
But how come they don't know about identity theft? Everybody's...
You're asking me impossible questions. Come on now.
Everybody's subject to that problem.
It's true. They are
It's
fixing
a
it.
monster problem.
So let's talk about A and B now. First, A. A is your hospital coverage. Now remember, I'm going to talk about original Medicare right now. When we get to the end, I'll show you that if you sign up for an HMO or PPO plan, a Medicare Advantage plan, then all of this coverage is wrapped into that plan, okay? So A is your hospital coverage. It covers the hospital, it covers skilled nursing, mental health care, hospice care, and some blood transfusion. So if you have hospital insurance, if you have Part A, it's to cover the hospital itself. It's not necessarily going to cover the doctors or the treatments that you receive in the hospital, because many of the surgeries and other things that happen in the hospital are going to be billed under Part B. So Part A has a deductible. If you don't have insurance, you have to pay a deductible the first day that you go into the hospital. And that covers you for up to 60 days. But that deductible is not going to cover your whole hospital stay. That's one misnomer that I often find with Medicare. People say, well, I know I have to pay a $1,300 approximate deductible for Part A, and that's all I'm going to pay in the hospital. No, that's not all you're going to pay in the hospital. That's just what you're going to pay for the hospital, the nursing, the bed, the food, that sort of thing. but the doctors are going to bill you under B. So most people get Part A for free. It has a deductible. This all has 2016 information. So 2016 deductible was $1,288, and I'm waiting for this to get updated. But Part B, as I said, is going to cover you for most doctors. And Part B is, as most people know, an 80-20 plan. You pay 20% and Medicare pays 80% of what is allowable. So a doctor may say that's a $20,000 knee surgery or knee replacement. But Medicare might say we only allow you to charge $1,000 for it. Medicare would pay $800, you would pay $200 under Part B. This covers physician services, outpatient, ambulance, many of the things that you think of as doctor's coverage fall under Part B. The premium right now for most people is $134. If you've been on Medicare for some time, then it might be slightly lower because they didn't increase it for people who didn't get an increase in their Social Security a few years ago. And so as Social Security catches up with the increases, then you'll see, for those who already have Medicare, you'll see your premiums go up and match those of others who already have had premium increases. So what's not covered under A and B? There are co-pays, there are deductibles, there's the 20% under B. In some cases, there's an additional 15% under B. Some doctors can charge 35% because they can charge what is known as an excess charge. A place like the Cleveland Clinic that has demand, or MD Anderson, or the Mayo Clinic, in many cases they charge the extra 15%. So if you only had original Medicare and no insurance to go with it, you could be paying 35% to see a specialty doctor. But most cases you're paying the 20%. It's important to know that as we get into our Medicare Supplement conversation.
I was going to ask you a question about that. Okay.
Yes.
I want to see if I understand this correctly. Okay, let me give an example. Like, say you're on traditional Medicare Part B. Okay, say the doctor charges $140, for example. Okay, and Medicare is only going to pay $100 of that. So you're responsible for the 40 between the 100 and the 140, right?
No. Let me explain that. So if the doctor says, let's say the doctor says this is a $200, sorry, this cuts a little small.
Just use whatever.
It's a $200 visit. Your visit is $200.
Okay.
They send it to Medicare, and Medicare says, no, $100 is what is allowable.
Okay.
How much are you going to pay, and how much is Medicare going to pay under that situation? Medicare is going to pay 80% of this, so they'll pay $80. The doctor is not allowed to charge you for the difference, so you'll only pay $20. They're only allowed to bill you for 20% of what Medicare allows. So even though there may be a $200 visit, if you were a cash pay patient, if Medicare says it's only $100, then it's an 80-20 on what Medicare allows for that service.
Okay, so they cannot charge you then, in this instance, the other $100 difference.
That's correct. They cannot charge you the $100 between here and here. The doctor cannot. But, as I said, some specialty doctors and clinics and things, they are allowed to charge an extra 15%, which is known as an excess charge. And that 15% means that they can charge it on this $100, not on the $200. On the $100, it's allowable. So in that case, you would pay $20 plus an extra 15. So you would end up paying $35 in a situation where a doctor is allowed to charge an excess charge. If the doctor has signed the contract to accept Medicare, then they can't charge excess charges. So they can't decide whether or not they're going to, decide if they're going to charge you the 15%. They have to decide whether or not they're going to accept Medicare. Now, accepting Medicare and billing Medicare are two different things. So there may be a doctor that says, we have not signed a contract with Medicare, but they can still see you as a patient, and they can still bill Medicare, and they can charge 15% extra. Follow me on that?
So how would you know if they, just because you get billed, or do you ask that question up front?
Well, I'll tell you my experience here in Las Vegas is that usually if you're coming to I have a friend that went up to Huntsman Cancer Center, and they said, okay, we need to explain something to you. we charge excess charges. And so they sat down with this man ahead of time and explained everything. But the place that we see it in Las Vegas most often is in the hospital. So I had a client that went into the hospital in a situation where she was almost completely unconscious. She doesn't have time to ask anyone whether or not they charge excess charges. So she found out when the bill came. So it's important, it's something that you should know so that if you're concerned about it like I am, you protect yourself with your supplement. You make sure that the insurance you have is going to cover this.
That's what I was going to ask, the supplement should pick that up.
But only some. And so some people make decisions to enroll in supplements that don't cover this because maybe they don't understand how dangerous this actually can be. Or the insurance agent is trying to help them get a low monthly premium. But the difference between a plan that covers this and one that doesn't is usually $20, $30 a month. And it is, oops, talk of benefits. Rewind the tape, delete that. But it's not a lot of money. So we stress that you should consider, if you're going to have a Medicare supplement, you should consider a supplement that's going to cover excess charges. The other thing that you should know is if you have a Medicare Advantage plan, the HMO or PPO, those doctors are not permitted to ever charge excess charges. So you're protected if you have the HMO or PPO, you never have to worry about excess charges. If you have original Medicare and you purchase a supplement, then you need to consider, does my supplement cover excess charges? Yes, sir.
There's a new twist in all of this
Okay.
that you just covered. I personally experienced it. All the doctors and all the nurses and certain other health, all are independent contractors now. And the problem is, if the VA doesn't pay my bill, the collection agency are coming after me for all this money because each one is billing directly, like it used to be just the surgeon would get the money. Now, we have these little facets of the hospital that are sending me bills.
Let me say this. I wish we took better care of our veterans. I wish we took better care of our veterans because what you're experiencing because of VA coverage does not happen to people who have Medicare. And it should not be that way. And I hope that those in power who can do something about it will do something about it. But this,
You can't get in the door unless you sign that release
Yes.
it warns you, we are all independent contractors.
yes, and I want to for the room, I want to explain. We spoke beforehand.
Yes.
This gentleman only has VA coverage; he does not have Medicare, and so he is subject.
Part A.
He has Part A, but he's subject to some things that people with Medicare are not subject to, and that's why that frustrates me. And I feel that those in power should do something. An independent contractor under Medicare is still bound by the Medicare rules, and they cannot bill a patient. They cannot bill a patient directly.
To have a nurse on an independent contractor base, not fair to the patient.
Yeah. Okay, so let's move forward a little bit here. We've been talking about Medicare supplements a lot. So I want to finish the supplement conversation and not confuse it. So I'm going to fast forward a little bit to our Medicare supplements and we'll discuss them in a little bit more detail. Then we'll go back and talk about the Medicare Advantage. So a Medicare supplement, as we've kind of illustrated, covers the things that Medicare does not cover in terms of deductibles and costs and things. All Medicare supplements are offered by private insurance companies. They have names, and their plan names are A, B, C, D, F, G, K, L, M, and N. I think they could have come up with something other than a letter, but they didn't. Now, each of these plans have different benefits, but the only difference between the plans is the insurance company and the premium that you're paying. So if you have a plan F, and you have it from an insurance company, and your neighbor has a plan F, and they have it from another insurance company, you have the exact same thing. But your neighbor might be paying more money than you, because the insurance company that they have might be more expensive. So then you ask in your head, well, why don't you just switch? Well, sometimes you can't. Sometimes you can't switch. So that's my little hook. I'm going to step back and kind of explain how this works. When you turn 65 or join Medicare, you can join a Medicare supplement, no questions asked, because you're new to Medicare. You just decide which one you want, choose the company you want, enroll, very easy, very simple, done. After 6 months, so you have 6 months to do that. 6 months after your Medicare started, now insurance companies, when you want to change, can health underwrite you, which means they can ask you health questions about how good is your health, and they can decline you. It's similar to how you might be declined for life insurance. In fact, the questions are very similar to a life insurance policy. In the past 2 years, have you been hospitalized? Have you been diagnosed with a heart condition? Do you have diabetes? Do you have this? Do you have, they concentrate on all these, COPD, et cetera, et cetera. So someone who joins a Medicare supplement, but then gets sick later and wants to change may not be able to change. They may need to keep the one they have and pay whatever premium is required so that they continue to have that coverage, because they won't be able to change to another insurance company. I think I have an open enrollment question coming.
Well, no, I'm just like,
No, okay.
well, yes, open enrollment, but also the whole pre-existing condition thing.
Yes.
I thought we weren't bound by that any
Okay,
longer.
so there's two things. I usually get, well, what about pre-existing conditions? I thought that was over.
Yeah.
That is over for people under the age of 65. But Obamacare only, as it's commonly referred to, only dealt with a couple of things with Medicare. It improved Medicare in a few areas, it detracted from Medicare in a few areas, but overall it was kind of a, yeah. But the rules didn't change. So with Medicare supplements, there still will be health questions after you've been on Medicare for 6 months. The other thing, open enrollment question I often get is, but wait, there's open enrollment every year, right? Can't I change during open enrollment? Open enrollment is for C and D, Medicare Advantage plans and prescription drug plans. So if you have a Medicare Advantage plan, the HMO or PPO, every open enrollment from October 15th through December 7th, you can change if you want, no questions asked. You can also change your drug plan during that time, no questions asked for the next year. But a Medicare supplement is not part of open enrollment. So in open enrollment, you can't change your supplement unless you go through the health questions and you are underwritten and the insurance company accepts you. Does that answer the question?
Well, can that be at any time in the year then?
And that could be any time of
So
the
if I
year.
didn't want to get off of this Advantage plan and go to a supplement, then they'll send me the life insurance type questions to answer. And then they'll decide if they want to accept it.
Yes and no. Yes and no. The challenge is, even though you can sign a Medicare supplement any time of the year, you can only exit a Medicare Advantage plan at certain times. So since you're already in an Advantage plan, we'd have to look how close are you to where Part B started, or is there some other election period that we can use to take you from the Medicare Advantage plan and put you into a Medicare supplement. So even though it's available all the time, you can't necessarily leave your Advantage plan at any time. Yes?
And what kind of person do you talk to make that switch? Is it an insurance broker? Or?
Yeah, all of this is done by an insurance agent. That's right. And that's what this is what we do at the Medicare store, is we do all the insurance side of things. So let me tell you a little bit about these plans. There's all those plans, and when you turn 65, and Miss, I don't know your name. Cheryl. Cheryl had the book, the Medicare and Me book. She called it the Bible, right? We put our hand on it every morning at the Medicare store. In there, it shows all these. And it says, what do they cover, what do they cover, what do they cover? Well, I can tell you really right now, my opinion. This is my opinion, but I think it's a very good opinion. There's only 2 of these that you should ever consider. If you're going to pay the money to have a Medicare supplement, you should either have a Plan F or a Plan G, and that's all. Because we talked about the excess charges. Imagine if you're going through cancer treatments and you have $100,000 in cancer treatments. Do you want to be responsible for $15,000 of that? And you're paying for a supplement? So the only supplements that cover that 15% excess charge are Plan F and Plan G. And so that's what I would recommend that you look at. Look at the Plan F and the Plan G. Sometimes you'll hear talk about the Plan N. It's a decent plan, but it doesn't cover excess charges. So I shy away from it. I just have had my own experiences where I've seen that the excess charge is just something you want to be covered for, in one way or the other.
What's the difference between F and F?
So there's a high deductible F and there's a Plan F. The high deductible is, let me step back and tell you that a Plan F covers everything that Medicare doesn't cover as long as Medicare pays first. So it's not going to cover something that Medicare didn't pay for. So if Medicare said, we're not going to cover that, then your supplement doesn't cover that. And usually if that happens, it's because the doctor's office didn't bill something correctly and they need to resubmit it, and then it usually gets paid by Medicare. But an example could be acupuncture. Medicare doesn't pay for acupuncture, so your supplement won't pay for acupuncture. But with a Plan F, if Medicare pays, then the Plan F picks up all of the remaining costs. Now remember, I'm only talking about the health part of things. I'm not talking about prescription drug coverage. So your prescription drug coverage was a separate plan. Remember I said you carry those all the different your wallet. So it doesn't cover prescription drug costs unless they're covered under Part A and B Medicare. And there are some, like chemotherapy and some treatments are covered under A and B. But if you're going to the pharmacy, generally speaking, it's not going to be covered under your A and B Medicare. So the Plan F covers everything that Medicare does. The high deductible Plan F doesn't cover anything until you've come out of pocket about $2,000. But once you've come out of pocket about $2,000, then it covers everything just like a Plan F. The other thing that you need to know about Plan F is that it's being phased out. 2020 will be the last time that people will be able to purchase a Plan F because just about two and a half years ago, a law was signed into order that said they don't want to have any coverage that covers everything all the time, because they felt that Congress felt that Medicare beneficiaries used their Medicare more if they didn't have to ever pay a deductible. So when Plan F phases out in 2020, then the top plan will be the Plan G. And the only difference between a Plan F and a Plan G is that a Plan G has a once-a-year deductible of $183. So you have to pay your Part B deductible of $180. After that, it's just like a Plan F that covers everything.
How much does the supplement cost, or does that change from person to person?
It varies person to person based on age, based on gender. Female rates are lower, male rates are higher because males tend to get sicker at younger ages. So it varies by individual. Yes, please.
How does, is there any impact when people leave the country temporarily, vacation or that, or they move for
Yes.
economic reasons and
Yes.
they're out of the country?
So the question is, what about when people leave the country? A Medicare supplement, Medicare does not cover you outside of the U.S., but a Medicare supplement has $50,000 in foreign travel emergencies. So if you're out of the country and you have a heart attack, heaven forbid, and you're, hopefully you're like in the Cayman Islands somewhere nice, right? Well, maybe not with a heart attack. Maybe you should be in Europe. But you have $50,000 towards that. And you're going to pay 20% of it, and your supplement's going to pay 80% of it. So that's the one case where they don't cover the full amount. But remember, Medicare's covering nothing. So it does give you some
Once you
foreign
leave
once you leave the U.S.
the U.S.
That's right.
Physically, even 3 days, you go to Paris or
Yep. Physically out of the country, you're not covered for by Medicare. So I tell people, when you travel, those travel insurance plans are not expensive. If you're cruising somewhere, it's a good idea to pick up one of those little travel insurance plans. You don't realize that if you're out of the country, you may have no coverage at all.
$5,000 for the body.
Yeah.
Just to
Right, if you want your body repatriated, then that can be expensive. So, okay, so let me see. What else do I need to tell you about Medicare supplements? That's about it. I can't actually go into details on costs, but we're talking, at 65, you may be talking a few $100s. When you get into your 90s, you're probably talking, $300-400. So per person per month, it can become costly, and that's why these other plans become attractive. Yes?
I have a question. If we're working, and like I have Medicare Part A now, but I also have coverage through my employer, so does that $1,288 deductible for a hospital plan, how's that gonna work? Is they gonna bill Medicare and my employer?
Very good. So your employer plan kind of works like a supplement.
Okay.
And depending on your employer, at the Cleveland Clinic, and so it's a larger group. That means that your employer plan is primary and Medicare is secondary.
Right.
And they work together to figure out, are there any costs left for you? I don't know what it specifically would be for you because every single group plan is different. But it will be mostly covered.
The deductible is taken usually by one of them, or do you have a deductible?
Usually it's going to be covered by between the two, you're going to pay very little, if anything. But it's different per person, for each person. Yeah. And then in that case, oftentimes, have you delayed your enrollment to Part B? Okay, that's wise. You almost always, the right answer if you're working and have Medicare is don't take Part B until you stop working. But you have to take it when you stop working.
Right, in 63 days.
Yes, yes, good. Please,
Yes, my situation is similar to the lady,
yes.
but I signed with Senior Dimensions at the beginning of the year, and I'm really confused because they gave me a card and they said, when I went to it only covers medication. And I thought it will be, I really don't know, he explained to me and I thought, okay, that's fine.
Do you
But I don't know.
have group coverage in addition to Senior Dimensions?
Yeah.
So you have working
They said
group
that it's
coverage.
only for medications, but I thought it was.
No, that's actually not true, and that sounds a little complicated. We really should look at that and one off. But
Talk to the agent.
most of the time, I'm not saying that what you have is not a good idea, but most of the time, it's not a good idea to mix a Medicare Advantage plan and a group plan because of the network concerns. But sometimes it's okay. We just need to look at the situation and see if it works. יש.
So as far as you know, all those other plans are gonna stay in effect.
They are.
except the F by 2020.
They are. There's no talk out there about changing the other ones, but honestly, I don't know why you would buy most of the other ones. Like K, for example, K only covers, it covers 10%, so you pay the other 10% of the 20%, and it doesn't cover excess charges. So I don't know why anyone would buy K. C is just like the Plan F, but it doesn't cover excess charges, and the difference is pennies. Why would you buy that? So I don't know why people purchase the other ones, but there's no talk about them changing.
Okay, just one more question. This is about the fee. Does $125 for somebody just getting onto Medicare like me sound reasonable for one of these supplements per month? But if you're like 75, it's like, say, $270 a month. Does that sound in the ballpark?
I'm going to be careful here because I'm not supposed to talk about
Just like
all that stuff.
ballpark.
But if afterwards you talk to Andrea, she can give you specifics on that. Okay. So I think we've got a really good understanding of the Medicare Supplement. I want to go back now and talk about the Medicare Advantage plan. So Medicare Advantage plan, so we got to totally change gears. We've been talking about Medicare with the supplement, with the drug plan. Now we need to talk about the plan that's all together in one. And right now, I can't give you pure statistics. You know, they say that 95% of statistics are made up on the spot, right? So I would say approximately of people turning 65, somewhere around 70% are joining Medicare Advantage plans. Maybe 30% are joining Medicare Supplements. So we've spent 70% of our time talking about Medicare Supplements, but only 30% of people are joining Medicare Supplements. Why is that? Well, it really comes down to cost, really. But there are some other things that are involved there that are benefits of a Medicare Advantage plan that you don't receive through Medicare and a supplement that also are very attractive. So I don't want you to leave today and have the impression that I prefer one or the other, or that I have an opinion about one or the other. I can tell you why both of them are wonderful. We just have to find out which one is wonderful for you. So let's talk about the Medicare Advantage plans. They're offered by insurance companies. I'll give you some names: Senior Dimensions, United Healthcare Medicare Complete, which is the AARP one, Humana, and CareMore, and Aetna. Those are the companies that offer these Medicare Advantage plans in Las Vegas.
Can you say those again?
It's United Healthcare, which is AARP Medicare Complete and Senior Dimensions. It is Humana, CareMore, and Aetna. Now, they have multiple plans in there. There's 17 plans total, but it's only 4 companies offering the plans: United Healthcare, Humana, Aetna, CareMore. Those are the only 4 companies, but there's 17 different plans to choose from. There are some plans that are based on your condition. If you have diabetes, there are diabetes plans. If you have chronic lung disease, there are chronic lung disease plans.
First, a minute ago you said Senior Dimension, but not.
Senior Dimensions is a United Healthcare plan.
Yeah.
It's just that a lot of people call it Senior Dimensions because it's been here for 30 years, and they don't know about United
Card says
Healthcare.
Senior Dimension.
It does, and then on the bottom it says, brought to you by United Healthcare. So Medicare Advantage plans are all combine your benefits together and are either an HMO or a PPO. There are some other varieties that are available in other places, but here in Las Vegas, it's either an HMO or a PPO with the Medicare Advantage plan. So you don't need to learn what these other PFFS, MSA things are. We just have HMOs and PPOs. The HMOs are beautifully cost effective. The cost to the member it's just fantastic. We have plans that you just don't find in other parts of the country. Las Vegas has what appears to be the best plans in the entire nation for Medicare Advantage plans. Why would that be? Why would Las Vegas have better plans than California and Florida and Arizona? Because in Las Vegas, we have 350, depending on who you talk to 400,000 people on Medicare, and they're all within like 20 minutes of each other. You don't even find that in Florida. You go to Florida, yeah, there are more people on Medicare, but they're more spread out. Here, it's just this really tight, kind of compacted area, and so the plans are fantastic as far as benefits wise. Also, with an HMO, a lot of times, if I say HMO, what are the first things you think of? Someone say HMO?
Provider network.
Network. What's the other thing?
You find doctors, there's only certain people you can go to.
Okay. And usually someone says to me referrals, right? Because with the HMO, you go to your primary care doctor and they refer you to a specialist. So usually someone says, well, I'm worried about, is the network going to be too small? And do I have to get referrals to specialists? So sometimes those are seen as the negative. We call that managed care, which means someone is coordinating your care. That's often viewed as a negative thing, but I'm going to tell you when it can be a very positive thing. Part of the reason why HMOs can be very positive is that as you get into a situation, as you age and you're seeing doctors and going through things, if you have Medicare and a supplement, there's only a little bit of coordination that happens between your doctors. You could go to your primary care doctor, go to your specialist, end up in the hospital, and none of them know that that's happened. Who has to tell them what's happened? You do. The patient has to. So when you think, oh, I don't want to be stuck in an HMO, this tight network, I have to get referrals. Well, if you don't have that, then everyone doesn't know what's happening to you. An HMO, the way that they are paid is based on improving the health of the members. If you go into the hospital and then you go home and you go back into the hospital the next week, they get dinged really badly. So the whole idea of the HMO and how they get compensated by Medicare is improve health, keep people from returning to the hospital by helping them get better. And so they coordinate care. If you're in the hospital, an HMO plan will always have a hospitalist in that hospital. A hospitalist is a doctor that comes and sees you, knows what's happening, puts all the information in the computer. Everyone in the network knows. They send information to your doctor, they send information to your specialist, they make sure that your medications are all coordinated. This sounds, maybe it doesn't sound as much of a benefit as and hopefully I can convey it as how I have seen it as a major benefit for my Medicare clients when they're in that situation. When they're in the hospital, they're not necessarily sure of what's happening around them, they don't know what's going on, they get sent home, they're not sure if all the stuff coordinates, if the drugs work together, etc. But someone is watching out. You also get assigned a case manager, someone which is a registered nurse who works in an office, and they view all of these things, they coordinate all these things, they make sure that you're getting your appointments that you need when you come out of the hospital. That's when it really shines, is particularly in the hospitalization. So some of these things that to some people feel clunky, like the referrals, the doctor network, they actually can make it so that they can provide very good care for the senior population that you would have to do all of that on your own or have an advocate help you with. Does that make sense?
So the case manager, say, would be United Healthcare. The case manager is under whom?
Under United Healthcare. In this case, if you have a United Healthcare plan, but it's under the insurance company, and it's a registered nurse.
But a PPO is not.
Now with a PPO, you don't have that same thing. And generally, we advise people to consider, HMOs or supplements, and then look at the PPO if the supplement's not available or if they don't want to go with the HMO. The PPO's
But if you
kind of
have
middle ground.
an HMO and you want a certain doctor, not so, right?
Correct. Yes, that is correct. Yes.
I actually called up my HMO not too long ago and I said, due to the fact that there's a big shortage of doctors here in this county and, I can't seem to get one very easy, can I see a nurse practitioner you people pay for it? Because,
Only if it's in their network.
Right. So I said, I gave them the name of this one that I found out. And they said, yeah, that's in our network, so you could go there.
Yes.
So I am actually looking forward to going to see a nurse practitioner. And my other friends say, well, you need to go see the doctor. And I said, why? I'm a former nurse. I know some things about the healthcare system, and I'm not sick.
I don't have anything. I personally don't have anything against nurse practitioners. I think it's very good. So one of the things that we at the Medicare store have kind of figured out are some of the ways that we can get people into certain places who are some doctor. We have doctors that we've worked with that maybe are trying to grow their panels and don't have as many patients. There are little tricks, but ultimately, whether you have an Advantage plan or a supplement, we have a shortage of doctors. And you're going to bump up against that no matter what insurance you have. And so sometimes it's a case of the grass is greener. It's tough in Las Vegas either way. But a nurse practitioner, I usually see one. I go to Southwest Medical, and there's one. I know, if you all want to know a little secret, the Southwest Medical on Durango and Tropicana, you can go in there and see somebody really quick, and they take almost every kind of insurance. I get in there, there's a guy I see, and it's my little secret, but don't tell too many people, because I think a lot of people haven't realized that little place opened over there. But let me see, I need to tell you a few more things about the Medicare Advantage plan. Most of the HMO plans have very low costs. I won't give you specifics, but just in many cases you can see your doctors and even be hospitalized without coming out of pocket. So there are different cost structures for every plan, so you have to look at the plan. You have to determine, is there a doctor in the network that you would like to see? Is your doctor in the network? Are you considering choosing another doctor? If you're coming here and you're seeing a doctor here at the Cleveland Clinic, you need to consider, is the doctor here going to be able to accept my insurance? And what is that going to cost? So you need to look at those things. The other thing that we look at with the Medicare Advantage plan is what prescriptions are you taking and how well will they be covered? And so we run your prescriptions and say, okay, these are going to be well covered under this plan versus that plan. Since there's 17 to choose from, those are the two major things that we look at is your doctors that you want to see and the prescriptions that you're taking. Keeping in mind that your doctors, you're not going to have everybody you want necessarily, but who's really important to you? Or is it more important to choose a plan that has the lowest cost? And the same with prescriptions. Maybe the plan doesn't cover that one prescription you're taking, but you could see a doctor and they could rewrite a prescription to something else. I'm not a doctor. I'm not going to tell you what prescription you should be taking. But I know that every plan covers prescriptions in every category. And so if the one you're taking isn't covered under the plan, then oftentimes the doctor can prescribe something else that works very well. But those are all things that you could consider when looking at the Medicare Advantage plan. Again, I just to kind of close my thoughts on the Medicare Advantage plan, referrals and networks, those things often are seen as a negative. And if you understand how the managed care model works, you realize that you can't have that managed care model with a huge network. So there's actually an advantage to you, but it can also sometimes feel clunky and you can butt your head against things. And one of the things that we've seen here is the improvement of that over the last few years. We have some Medicare Advantage plans now that have 4.5 out of 5-star ratings, that's rated by the government, so their customer service and satisfaction has significantly improved.
So you're recommending, if you're on an Advantage plan, that you have to say, send my documents, let's call it, to so-and-so doctor. Is that true?
No. If you're on an Advantage plan, all of that happens for you. If you're on a supplement, then you have to do that yourself. Because Medicare doesn't coordinate stuff for you. Your supplement doesn't coordinate stuff for you. They don't provide an in-between person that's calling all of your doctors and stuff. And some of these plans, like on a diabetes plan, they'll call you every week. Hey, did you take your medication? What were your numbers? And they're on top of you because their goal is to improve your health. So there could be some real positives there. So just to wrap, we're running out of time here, but just to wrap up real fast, we talked about the supplement. And the best thing, if you can understand this, you're way ahead. If you understand the supplement, the a la carte side, and the Medicare Advantage plan side, I will say again, I have no preference from one to the other. People ask me oftentimes, well, which one's best? There is no best. Everyone is tailored for certain people in certain situations, and we just need to determine what is the best for you, and that's really what the goal is, and that's what your goal is. So you don't, it's not that there's one that's better or something, they're just all different. I appreciate the opportunity to come back here to the Cleveland Clinic, and hope that that you had your questions answered, and if there's anything afterwards, I'd love to stay and answer your questions. Thank you.